Right. Well, thank you very much for coming in today.
Mhm.
I appreciate it, and I just have a few questions to start out, and we've uh, uh, I just want to get an idea of kind of where you're coming from here before we get into what brings you here today.
Okay.
Is that okay?
Mhm.
Um, what is what's your name?
Stacy Miller.
Okay, Stacy. Um, what would you? I mean, how would you describe like your nationality?
Um, an American.
From America. So from America.
Yes.
Okay, so then um, I mean, are you uh, Eskimo, like uh, Irish, that sort of a thing? Like, what's your ethnicity? Um,
Oh, I identify as a black person.
and so that's okay to say then, black.
What do you mean?
You just hear like, I mean, African American, and I'll say that like it's race. I mean, that's when you say black. I mean, that's race, and I don't really like. Where'd you go? Because I don't see race. I'm blind. I'm completely blind to it. Where are you?
Where am I?
Yeah, I can't see you because I'm
So I'm
blind.
invisible?
Well, you're not invisible. I'm just saying because I don't see it. I've got I know a lot of black people, but I don't see them like that. So I don't want to be insensitive in that way. But you would say black, but that's okay to say.
Yeah.
All right. Um, and what sort of work do you do?
I am an RN at a hospital.
How did you get into that line of work?
All of my family have professions in the medical field. So I grew up around it, found a
Mm,
passion for it. So,
that's neat. Well, you're very articulate, and I think that certainly says a lot. I mean, you represent where you're from and your family and your race, very well.
is that a compliment?
Well, of course, yeah. And how did you get? I mean, how'd you get so good at science and medicine and all that?
Well, how'd you get so good?
Oh, I had to study. I mean, it takes some hard work, and I feel like it kind of runs in my family a little bit. And but I mean, I'm interested. I mean,
Yeah.
how'd you get so good at it?
Well, it runs in my family too.
And there wasn't like a neighborhood program or something with like helping kids get into science and raising kids up into the sciences who may come from like difficult backgrounds and stuff.
I'm sure those programs exist, but I didn't come from a difficult background. I actually grew up in a pretty wealthy neighborhood.
Okay,
And so if you were asking, the tutors actually helped me
that's good. Okay,
refine my skills.
so you had good tutors and good mentors out there to kind of guide you along and you know show you what opportunities are out there. That's great. Um, and uh, what Stacy, what brings you in today?
So I just got a new position at the hospital, and I'm just experiencing some stress from that.
Okay, so it's hard at your job, is what you're saying.
I'm saying I experienced some stress from
Hmm.
that, not necessarily saying that the job is hard.
Okay, stress as like stress in your muscles. Is it from kind of being on your feet all day and getting out there and working and having to be a part of the grind?
No, it's just stress related to some coworkers and some pretty hurtful things.
So your feelings are getting hurt?
Um, yeah, I guess you could say that.
That's not good. I mean, that's got to make things a little difficult for sure. Um, and yeah, we'll talk a little bit more about that. What sort of things do you enjoy doing?
I like to go camping. I like to read, and I also dance a couple times a week. I run
Dancing.
too.
Okay.
Yeah.
Like hip hop dancing and stuff. Is that what the kids are into?
Um, so I'm not sure if the kids are. I mean, I'm sure some kids are into that. But the dance I do is actually called modern.
Oh, so
Are you familiar with modern?
is that what they're calling? I mean, is that kind of the new term for what hip hop is? I mean, I've done a little bit of hip hopping, like at some receptions and stuff. So we have a black uncle, and he does some of the hip hopping with us, and he's kind of given me a stamp of approval that I can get out there and dance with him at family get-togethers and things.
Well, good for you.
It's just by marriage, obviously. Um,
Mm.
and we always joke that he's a brother from another mother. You heard that one
Mm.
before?
Yeah.
So that's what we call him. He loves us, and uh, it's weird because it's we have him that at family get-togethers and things, and we always try to ask him, how can we get more involved in helping blacks, and getting out there in the community and serving, and um, what do you think? I mean, as what's the black experience like, and how can we become more involved?
Um, so the black experience, you can't is very complex and it's very varied. You can't just make a generalized statement about what the experience is like.
Hmm.
And I uh, forgive me if I'm being a bit forward, but I don't understand what this has to do with me and my stress at work. It seems like this is more about you.
No, and I don't mean to. I mean, I certainly don't mean to be offensive. I get that race is a very sensitive topic, and we probably shouldn't talk much about it.
No, we
Um,
can talk about it. Absolutely.
I just believe and I'm sure you'll agree, it's about changing hearts and minds. That we need to get out there and create a safe place that we can all just talk about it. And so I'm always here if you ever want to open up a dialogue
Well, you're not making it quite safe for me.
in what way? How do you mean?
Well, you're making it about you.
Well, it's hope that I'm not doing it that way. I think that because again I try not to see color at all, because I want us to have a good dialogue about it. And I just I'm curious, I guess, and so if we digress a little bit, let's get back to your work stress, because that seemed to be a safer issue with you. And so what's going on at work?
Well, I shared earlier that I'm just experiencing some pretty hurtful things from some people who just have no reason to treat me in this way, but for whatever reason they are.
Mm.
And I don't know why they are treating me this way. Of course, I've got some ideas, but
What kind of ideas do you have?
oh, maybe because I'm a black woman and I also appear young. So often my credibility comes into question. whether it's with patients, whether it's with the staff there. I just, I don't know. It's
So they're
just,
being racist. I mean, are people like
yes,
calling you names and trying to say that you can't use the facilities? And is that what's happening? They're just working with a bunch of racists.
that's not what I said. I'm not working with a bunch of racists, but I'm saying I am experiencing some racist events at work, some
Hmm.
racist interactions that are really impacting me and my ability to complete work.
I think I actually get that. I mean, um, I went to a Sam's Club once and um, took out my Costco membership, and you wouldn't believe the look that this person gave me, and it was hard. It's really hard. Um, and I had a choice in that moment that I could either continue to shop there and go for that nacho cheese that's there, and or I could turn around and I could go elsewhere. But I stood my ground. I mean, I think you'll find that if you get out there and do that, things can change. Real change can happen. Can you work harder? I mean, have you thought about that?
Can I work harder? No, I can't.
So you're already. I mean, you're spent, pretty well spent?
I mean, I'm doing the exact same tasks as the other RNs in our department, so there's nothing more than I can do.
Hmm. That does make things difficult. And I don't know. What do you think you'll do? What's the next step for you?
I don't know. That's why I'm here. I'm trying to find ways to manage the stress.
Yeah, we can. I mean, we'll probably look into some, relaxation type exercises that we could work through. Uh, there's some different strategies that we can try. I want to be sure that we haven't just hit more of the practical things here too. That getting out there into the big boy world is tough, and it's about pulling up the bootstraps and getting out there and doing what we can, and not cowering down every time someone hurts our feelings. It's just a I know that could be a little bit of tough love,
Mhm.
um, but um, I think you can succeed if you try hard.
So, just to be clear,
Hmm.
if you're saying that I'm cowering down in my work environment, and if I just pull myself up by my bootstraps, then the stress will go away?
That works for me.
Hmm.
Got other friends too. It works for them, and I think it's my job to show you to show you the way, to lead you, and um, sometimes that's what's needed.
So, what happens if it doesn't work?
Well, if it doesn't, I mean, I just know that there are other. I mean, there are other Black people that succeed out there. I mean, you look at Condoleezza Rice, and there's Ben Carson and Mario Lopez, and I mean, there's other people of color succeed, and they get out there, and I'm sure that they just tried really hard and they did it.
Hmm. So, just try really hard.
Yeah, yeah, and it's a man's world, and I get that it can be difficult, but like I said, let's try some of these relaxation techniques. And have you heard of mindfulness? It's a it's more of a Far Eastern thing. It's not like, I mean, it's another culture, and I don't want to get into that because it could be sensitive. So, but
Yeah, I'm
it's
Buddhist.
yeah, your boot. Really? It's a okay. Um, And we'll have to, and I don't want to get into the religion because I know that that can be sensitive too. But um, I, I think it's best if we just focus on getting you better. Does that make sense?
Mm, okay.
All right, good. I just want to be a good father figure for you out there. I know that there aren't many fathers left in black neighborhoods, so uh,
My neighborhood
sometimes
was predominantly white.
no, it's true.